Okay, so today we're diving into something super fundamental,
Mhm.
like the bedrock of how our lives are structured, those big systems, the social
You
institutions.
got it. We're talking education, family, religion, government, the economy, even healthcare itself. All these systems shaping our behavior, our chances, pretty much everything.
And for anyone listening who's, pre-med on that MCAT track, this is like must-know stuff, right?
Absolutely. It goes way beyond just textbook knowledge. This is about understanding the real lives of your future patients, the social forces that impact their health.
Exactly. It's like getting that big picture view, that sociological
You
lens.
need that to be a great doctor, no question. So, ready to unpack these institutions, we've got 5 big ones to explore.
Yeah, let's do it. Starting with, I guess, the one we're all most familiar with, at least from personal experience, education. But sociologically, it's way more than just showing up to class.
Right, way more. Think about it. Even before you learn, say, history or math, you're learning something just by being in school. That's what we call the hidden curriculum.
Hidden curriculum. Okay, kind of mysterious.
It is, kind of. All those unspoken lessons you pick up about behavior, values, social norms, like how to follow rules, respect authority.
Oh, I see. Stuff they don't put in the syllabus, but you learn it anyway.
Exactly. Take something as simple as raising your hand to speak. No one explicitly teaches you that, right? But it's a huge lesson in order, taking turns, all that.
Wow, yeah. Like we're being programmed for how society works without even realizing it.
In a way, yeah. And that leads to some interesting effects, like the teacher expectancy effect.
That's the one where teacher expectations can actually shape how students perform, right?
Exactly. If a teacher believes a student is capable, they might give them more attention, more challenging work. And that belief can become a self-fulfilling prophecy the student actually does better.
It's almost like the power of suggestion.
Yeah.
But flip that around, low expectations.
Unfortunately, yeah. The student might internalize those low expectations and underperform, which links right into the idea of educational stratification.
Stratification meaning layers, right? So basically, unequal access to good education.
You got it. Factors like socioeconomic status, race, where you live, they can create huge differences in resources, opportunities. Not just about fancy buildings, it's about the quality of teaching, the curriculum.
And that impacts kids for their whole lives, even their health down the line.
Absolutely. As future doctors, you'll see this firsthand. The varying levels of health literacy your patients have, their ability to navigate the healthcare system.
It all ties back to those early inequalities. Okay, let's move on to another big one. Family and kinship. How do we even define family from a sociological perspective?
Well, it all starts with kinship, really. Those social bonds you form,
Yeah.
could be blood relations, marriage, adoption, broadens the idea beyond just the nuclear family.
So we're talking extended families, aunts, uncles, grandparents, all that.
Right, the whole network. And different marital structures, too. Monogamy, polygamy.
And then there's chosen families, right? Those super important bonds that go beyond legal or blood ties.
Exactly. Especially crucial for folks who might not have those traditional family connections.
It's about who you consider family, who you rely on. Now, when we talk about family, we also have to talk about things like marriage and divorce. Sociologists look at the trends, the societal impacts, right?
Right, for sure. We look at how those trends impact child rearing, for example. And of course, we can't shy away from the tough stuff. Family violence, child abuse, elder abuse, spousal abuse.
That's heavy, but so important for future doctors to be aware of.
Absolutely. These are public health issues with serious physical and mental health consequences. Understanding family dynamics helps us recognize and address these problems.
It's a reminder that even the most fundamental social unit can be complex, even fraught with challenges. Okay, on to another big one, religion. More than just individual faith, right?
Way more. It's about organized systems of belief, practices, rituals, often shared within a community of believers, provides a framework for understanding the world, your place in it.
So how do sociologists classify these religious organizations? We hear terms like churches, sects, cults.
Right. Churches tend to be large, established, integrated into society. Sects, often smaller, break away from those established churches, might have more distinctive beliefs.
And cults.
Usually newer movements, often with beliefs or practices considered outside the mainstream, can be controversial.
Got it. And what about religiosity? Is that just about how strongly you believe?
It's more than that. It's about how you express that commitment, how often you practice, how important your faith is to your daily life, how much religious teachings guide your actions. It's multidimensional.
So it's about walking the walk, not just talking the talk. Now, it seems like religion can be a force for both keeping things the same and pushing for change.
That's a great point. It often reinforces traditional values, social norms, but historically it's also been behind major social reform movements, fighting for justice, equality.
So powerful either way. Now, we've also got these terms like modernization, secularization, fundamentalism. How do those fit in?
Well, modernization, with its emphasis on science, rationality, individual choice, often leads to religion becoming less central in society. That's secularization.
Like a shift away from religious explanations for things.
Exactly. And then you have fundamentalism, which is often a reaction to that secularization. Strict adherence to traditional doctrine, wanting to bring religion back to a more prominent role.
It's like a pendulum swing back in the other direction. Okay, let's tackle government and the economy. And power dynamics. Can't forget those. They all seem so intertwined.
They are, for sure. Let's start with power versus authority. Power, at its core, is the ability to impose your will even if others resist.
Okay, raw power.
Yeah. But authority, that's different. That's power that's seen as legitimate, justified in the eyes of the people.
So it's like, I could try to force you to do something, but if
Yeah.
I don't have the authority.
People won't comply willingly, and it won't be seen as right.
Right. Think about paying taxes. We grumble about it, but we do it because we accept the government's authority to levy those taxes.
Exactly. It's based on laws, on a system of governance we recognize as having that legitimate power. Makes sense.
Total sense. Now, economically speaking, what are the main systems we look at through a sociological lens?
The big ones are capitalism, socialism, and then mixed economies, which blend the two. Capitalism is all about private ownership, the profit motive. Socialism emphasizes collective or state ownership, more focus on social welfare, equal distribution.
And how do different political systems play into all this? Democracies, monarchies, authoritarian regimes.
Right, they all shape how power is distributed, legitimized. They influence how much the government gets involved in the economy, how individual rights are protected. It's the whole framework for economic activity.
Makes sense. And then there's the concept of division of labor, which I usually associate with like factory work, assembly lines, that kind of thing.
That's the classic example, yeah. Specialization of tasks to boost efficiency. But the division of labor goes way beyond that.
Oh, really?
Yeah, think about a hospital. You've got your highly specialized doctors, nurses with their own expertise, administrative staff, and so on. All these distinct roles.
Like a finely tuned machine, everyone has their part.
Exactly. And that specialization is essential for healthcare to work. But it also creates hierarchies, systems of interdependence. It's a social structure, too.
Makes you realize how complex these systems are, even the ones that seem straightforward. Okay, last but not least, health and medicine itself. Feels kind of meta, given our focus on future medical pros.
It is, kind of, like we're analyzing the very system we're preparing you to enter. And one of the big concepts here is medicalization.
Medicalization.
Yeah.
So turning things that aren't traditionally medical problems
Yeah.
into medical problems.
You got it. Taking something that's part of the human experience, maybe a social issue, and defining it as a medical condition requiring treatment.
Can you give us an example?
Sure, think about menopause. It's a natural biological process, right? But increasingly, it's been medicalized, framed as something needing hormone therapy, medical management. Another example, shyness. Sometimes that gets medicalized as social anxiety disorder.
It's like the line between what's normal and what needs medical attention is always shifting. And what about the sick role? I've heard that term.
The sick role. Yeah, that's sociologist Talcott Parsons' idea. It's about the expectations we have of people when they're sick. They get to temporarily opt out of their usual responsibilities, work, school, whatever.
Like getting a get-out-of-jail-free card almost.
In a way, yeah. But it comes with expectations, too. The sick person is expected to seek treatment, try to get better. It's both rights and responsibilities.
So being sick isn't just about how you feel physically, it's a whole social thing.
Mm-hmm.
And does that tie into the illness experience?
It does. The illness experience is all about how the individual experiences their illness, their perceptions, interpretations, how they cope. It's not just the biological disease itself, it's the whole lived reality of it.
So two people with the same diagnosis could have vastly different illness experiences.
Exactly. Influenced by their culture, their social supports, their beliefs, even stigma around their condition. It highlights the human side of health and disease. Can't forget that.
For sure. Empathy is key in medicine. Okay, last concept, social epidemiology. This one seems super relevant for tackling health disparities.
Absolutely crucial. Social epidemiology looks at how social factors think Socioeconomic status, race, ethnicity, gender, geography influence health outcomes. Why do some groups have higher rates of certain diseases? How do social inequalities play into this?
So it's connecting those big social institutions we've been talking about to actual health outcomes.
Exactly. Educational attainment impacts health literacy. Family structures influence caregiving. Economic policies affect access to healthy food, safe housing. All these factors, shaped by social institutions, have tangible effects on health.
Wow, it all comes full circle.
Okay.
Now, let's do a quick recap. We've seen how education is about way more than just knowledge, how families come in all shapes and sizes and face all kinds of pressures.
And how religion can be a powerful force for both stability and change, and how government and economic systems shape resource distribution, power dynamics, and finally, how health and illness are deeply embedded in social contexts.
It's a lot, but it's all connected.
It is. And for our future doctors out there, remember, understanding these social institutions, that's a key part of understanding your patients. It'll help you provide truly effective, equitable care. Can't separate the social from the medical.
Couldn't have said it better myself. Thank you so much, Doctor, for these incredible insights. This has been eye-opening, really.
My pleasure. Glad we could dive into this important topic.
And for everyone listening, especially those on the pre-med path, take some time to think about how these social institutions have shaped your own life, your education, your family, your beliefs, even your health. Seeing those forces at play, that's what'll make you a more insightful, compassionate physician.
Couldn't agree more. It's all about connecting those dots.
Thanks again for listening. We'll see you next time for another deep dive.
Good to them.